We're going to discuss now sudden infant death syndrome, otherwise known as SIDS. This leads us into a discussion of apnea. SIDS in and of itself is the most common cause of infant mortality between 1 month and 12 months of age, outside of that first month. Apnea is many times a presentation of SIDS. Apnea by definition is no breathing for 15 to 20-second period. And it can be broken down into obstructive apnea, central apnea, and the most common cause of apnea is mixed apnea. There are various risk factors for apnea and SIDS. Certainly smoking, sleep positioning, those are things that you need to remember. Not smoking of the baby, but exposure to smoke. Physical exam is basically normal. Babies who have apnea have a normal physical exam, except when they're having their apneic periods where they can have duskiness or cyanosis. The best test to work to help with the diagnosis of apnea is polysomnography or a sleep study. This can be used in various ages, and the baby is hooked up to different monitors, or the older child may be hooked up to different monitors, and they will look for respiratory rates and also flow rates to see if there's air moving in or out. They look at for desaturations, etc. Apnea can be subdivided into what we call apnea of prematurity. Many preterm babies just don't have the central nervous system maturity to breathe all the time, and so they will have apnea. This is usually treated with nasal CPAP or with caffeine or other methylxanthines. Cyanotic breath holding or the breath holding spells, usually in an older child, 15, 18 months of age. They cry and then they hold their breath and they kind of turn blue and fall down. And then there's the obesity hypoventilation syndrome, usually in older children. It's pretty self-explanatory. These children are overweight and they can have apnea and hypoventilation. SIDS is the sudden death of an infant. It is going to be unexplained by the history, and it's unexplained by a very thorough post-mortem exam. There's a lot of research being done on sudden infant death. There's a lot of efforts, and we still know very little. Typically, these babies are fine. Then usually in the winter time, usually at around 2 months of age, usually between midnight and 9 in the morning, the baby has been put to bed, doing fine. The mom or the dad goes and checks on him, and the baby is basically dead. They're usually brought in and pronounced. And then the autopsy does not really reveal much. It is the most common cause of infant mortality after 1 month of age and up to 12 months of age. And certainly one thing we do know is that by sleep positioning has really helped to decrease the incidence of SIDS. So that's what you're going to have to really remember for the exam is that the peak times, the peak ages, the fact that they don't have many findings, and how can we prevent this? Putting the babies to sleep on their backs unless they have obvious reflux problems. Sometimes on autopsy you can find some petechial hemorrhages, but findings are very nonspecific. These are some of the risks for SIDS, such as low socioeconomic status. African Americans and Native Americans are higher risk for SIDS. Also, the age group, I said, around 2 months of age is the peak age for this to happen. The peak time of the year is going to be in the winter and around between midnight and 9 a.m., a little bit higher in males versus females. Other risks are pregnancies that have been close together, patients that have had less prenatal care, low birth weight, preterm babies, babies that have intrauterine growth retardation are at higher risk, passive smoking, maternal smoking are all put you at higher risk, and these are modifiable things as opposed to the others. We certainly know that laying to your back to sleep is much better. It's even better than laying on their sides, and American Academy of Pediatrics recommends that they be put on their backs. We also try to avoid soft bedding. Pillows definitely are a no-no. Being close to heat systems or heat sources, which can happen sometimes in the winter, puts them at higher risk. Pacifiers recently have been shown to decrease the risk of SIDS also. Home monitors are helpful, but they don't prevent the disease from happening. They merely warn you that something is happening, so they can give you a false sense of security. So for the exam, remember the characteristics, remember back to sleep, probably the most important thing you can do.